Thank you. We did discuss this somewhat yesterday, and I do understand the um, the painful differences that people who oppose abortion feel compelled to do that, to limit the ability under the law for women to have abortions. And of course, Roe v. Wade made very clear that abortion in the United States was legal. It's not a matter of being pro-abortion or not. It is about freedom to determine, for women to determine their future. Now, understand too that when we talk about the Hyde Amendment, we are talking not only, and we talk a lot about, and we should, about low-income women, because women of any of means and mobility are able to get abortion services. But it also applies to all federal employees. Imagine being a woman overseas in a war zone, for example, and you get pregnant. The medical facilities there are not available to her to end an unplanned pregnancy. Or if you're in the Peace Corps and you're in a country where healthcare may not be healthily available. Because actually, in terms of danger to women physically, abortion done in a timely way is less dangerous a physical state than pregnancy. But we have also seen, particularly in this pandemic, that women of color, low-income women, face maternal and infant mortality much more, tremendously more than white women. And there's a sea change now in this country going on where women are saying, this is the ultimate freedom, that it determines the rest of my life. And if I can avoid it with birth control, great. But if I haven't, and now we've got laws that are saying even after 6 weeks, when most women are not even aware that it's illegal. Now you're getting at the point of whether or not we should all say that it should be covered, that abortion services are health care, and that, but you say no, and it shouldn't be paid for. There's a lot of things like war, for example. There are people who don't want to pay money that goes to war. There's people that don't want to pay taxes for all kinds of reasons. That's not how we operate in this country. We make decisions about what our priorities are. And I would suggest that the ability of women and their families, their God, their doctor, should be free to make that decision and able to do it, and not prohibited because they don't have the money. There is now a majority in this country who think that women should be able to make that decision on their own, have the freedom to make that decision on their own, regardless of their income, of any other, their zip code, their, that it's their decision. And so I think it makes perfect sense now to say that no one has to have an abortion. Of course not. And no one is prohibited from believing that it is the wrong thing to do. I get that. And that's a privilege that we have in this country, but it is not a privilege to impose that on women. And in the case of low-income people or women overseas that work for the government, to have it forced on them to carry a pregnancy to term. And I yield back.